Hi friends, is it audible? Hi friends, good evening. I'm very happy to meet you all in this FMGE January 2025 recall session. I hope like you would have all had the exam and now you're all relaxed. Yeah. So what we are going to do is we'll see the topics in which the questions have been asked in the PYQ, and if we find that we see that there is a among the topics the questions that has been asked is as expected there has been questions from schizophrenia, okay, which was again discussed in the class. Mood disorders is a question which was expected and has been told in the class itself that this is a topic where they will ask questions. It's very important, and so the same question was asked, so I was very happy. Neurosis, again it was discussed in the top exam in the class. Heat, sleep, sex and personality disorders, one question was asked which was again discussed in the class. Substance use disorders, it's the most expected question. I was very happy because what happens is that when I used to always say students, see, if you are a very person who's running a tight schedule, okay, if you're not able to read the full of psychiatry, okay, read only two questions, the whole psychiatry, just read only two questions, and one of the question was the question that I told you and that was asked in the exam. I was very happy. Okay, next is pharmacology, which is again an expected question, okay, which was discussed many times in the class. And this time there was no forensic or community questions. And MSc and psychology, there was one question again which was discussed in the class. So totally there was around, what we got was around, like we were getting around 7 questions, and all the seven questions were 100% were discussed in the class. So I was very happy that we were able to get nearly 100% of the questions which was discussed in the class, which is what makes it life very easy and also very happy. So I was very happy to discuss these questions now with you. First and foremost was the topic on schizophrenia, question on schizophrenia. Okay, so which kind of symptom does the term affective flattening imply? Okay, affective flattening means what? There is no emotions in your face and the person is having the blunted emotions. Okay, so where does it comes under? Okay, the answer was negative symptoms. As you see in the workbook also, I've always told that, see, positive symptoms, negative symptoms. Okay, this is what has been asked multiple times in the exams. You should not make a mistake. Positive symptoms means, I've told you, see, imagine that you're all so-called normal people. Okay, you're all so-called normal people. I am a person with schizophrenia. I have something extra, I have something more, I have something positive. It's called positive symptoms. So what does a normal person doesn't have but a schizophrenia patient will have extra is nothing but delusions and hallucinations. It's nothing but delusions and hallucinations. Whereas negative symptoms, I have told you, everything will start with A. Okay, so please concentrate. Negative symptoms, everything starts with A. What is that A? It can be A motivation, asociality, affective flattening, or some questions will call it as apathy, avolition, alogia. Everything starts with A. So affective flattening is a negative symptom because what a normal person has, imagine that you're all so-called normal people and I'm a person with schizophrenia. What you are all having, I'm a person with schizophrenia, I'm devoid of something, I'm negative of that, then that is called as a negative symptom. And it is one of the most expected question. So, and it was discussed in the class, so I was very happy when they have asked that. So which of the following is a negative symptom is starts with A. So the answer was affective flattening comes under a negative symptom. Next is the mood disorders question. Mood disorders question, they have asked you, a 24 years old male previously diagnosed with a psychiatric disorder. He is becoming aggressive, is speaking rapidly, and is sleeping very little. He also exhibits hyperactive behavior after discontinuing his prescribed medications. What is the most likely diagnosis? The answer seems to be very clear that it is a bipolar disorder manic episode. See, when I was taking a class, I used to always say that somewhere the examiners are kind-hearted, where when it comes to mania, because they feel that okay, mania is some which different diagnosis, or it's a very important diagnosis. If students are able to diagnose based on the clinical symptoms itself, it is maximum that we can expect from the students. And most of the time the question will be a clinical scenario question. I can still remember saying this in the class. And what happens is that there are symptoms. See, I always say that don't read mania separately, read depression, because you're all living with depression. If you're preparing for FMGE exam, then it means that you could have had some type of depression, at least during your preparation time. Now, what are all symptoms you're having? Exactly opposite that symptom, what you have is called mania. Okay. Now, what happens is that in depression you will have low mood, whereas in mania I have told you that you'll have elated mood. Yes, yes. In depression, there will be decreased interest in pleasurable activities, whereas in mania, you'll have increased involvement of pleasurable activities with more amount of energy level, decreased need for sleep. You will have flight of ideas. What is flight of ideas? One idea jumps from other idea to other idea, another idea will be jumping. So it is called as flight of ideas. Pressure of speech. What is pressure of speech? Like a pressure cooker. Okay, just when you have a pressure cooker, with just like as the pressure comes out of the cooker, so there will be too much of thoughts or too much of content from the speech. That is pressure of speech. And obviously they'll have grandiose delusions. What is grandiose delusions? I'm claiming that I am extraordinary popular person. I'm saying that Ambani is a very poor man. Yeah, I've given him some money as a loan. That's why he's rich right now. Every day he calls me and gets my blessings. So I'll be claiming extraordinary things. I know a lot of people. Shah Rukh Khan is a very small actor. I only give him ideas how to select scripts for acting in movies. So I claim that I know a lot of people. I have a lot of contact with celebrity. I am a very popular person. So that is nothing but grandiose delusions, which is the symptoms of mania. And they have asked this exactly. See, speaking rapidly, which they are asking about pressure of speech or flight of ideas, sleeping very little, hyposomnia. See, when you are happy, naturally you will not go and sleep, because you feel that okay, I'm having too much of plans, too much of ideas, I want to do a lot of things. So you will be sleeping very little. Is hyperactive, his energy is too much. And what is the diagnosis? Is aggressive with neighbors. So it is nothing but mania episode. Yes, again, very very expected and very easy question. Now next is neurosis. Okay, now the question on neurosis is a lady presents to the hospital after having a fight with her husband. Okay, there is some problem, there is some trauma, some psychological trauma. She reports that she is unable to speak. There is a trauma and she presents with the symptom that she is not able to speak. Okay, she is converting a psychological pain to a neurological symptom. Okay, conversion disorder. However, all neurological and physical examinations are normal and she does not seem concerned about her health status. What is the most likely diagnosis? The answer is La Belle indifference. See, do you remember this is taken from our notes? If you see, I have written that La Belle indifference means apparent inconcern towards one's own illness. Apparent inconcern towards one's own illness. See, what happens is that I am having a guilt. I am having a psychology. See, the trauma, the guilt here is yeah, what is actually conversion disorder is there is a psychological guilt or psychological pain which is converted into a neurological symptom, okay, functional neurological symptom. Okay, but neurologically everything is normal. Okay, so the very important keyword that I always help students is know is neurologically everything is normal. So in your question, please look into these two words. First clue is that there is a trauma and the trauma is converted to neurological symptom. 2 days before or 1 day before there was a trauma. Second, neurologically but everything is normal. Third, see, imagine that you are not able to walk, you are not able to see, you are not able to hear, you are not able to talk. Yesterday night you are normal, suddenly today morning you are not able to walk or talk or not able to see. How will you be? You'll be anxious. What happened? I was fine yesterday. What is happening suddenly? You'll be anxious. But this person will not be concerned. That is called as La Belle indifference. La Belle indifference. What is La Belle indifference? La Belle indifference is apparent inconcern towards one's own illness. Again, this is a very important topic which has been repeatedly asked in your, say, I always say students, okay, if you are preparing for FMGE also, don't stick only to FMGE question paper. Just have an idea of what is happening in the NEET and INICET question paper. I say the same to the NEET students also. If you have a NEET, you are preparing for the NEET exam, it's okay. Just have an idea of what is happening in the FMGE exam. Because this word La Belle indifference has been recently asked in an INICET question. Okay, you just don't need to go dive into the contents, or already I have too much of content, how should I read? No, just read the question and answer, that's fine. Now what happens that if you have known that, okay, if you have known that PYQ, that this question has been asked in a NEET question or INICT exam, you would have just within 2 years. Okay, so you know that this has been repeated. Labile indifference is nothing but apparent inconcern towards one's own illness. And again, there will be another question which was asked, I'll tell it now itself. It is most common in females, either it is children or adolescents. It is more common in children, females. Next, there was a question on eating disorders. Eating disorders, they will be very much they like anorexia nervosa and bulimia nervosa. The question is, a young female reports episodes of binge eating followed by self-induced vomiting. Okay, whenever I take a class, students are very clear about this. Eating and vomiting means they say, sir, it is bulimia nervosa. Yes, very good. You are searching to answer bulimia nervosa, but they have not asked that. She is most likely to have which of the following acid-base disturbance. Now it's very simple. Even if you don't know what is bulimia nervosa, you don't know what is the spelling of psychiatry, just common sense. She is vomiting. Now along with vomiting, what happens? The acid will, along with the food, the acid comes out. I've been telling it in classes. See, the textbook description of bulimia nervosa will be a female who will be sitting near a toilet seat. She'll be having a plate full of pizza, pasta, cookies and cakes and all that. What she'll be doing? She'll be eating. She'll be binge eating. Now what happens? There'll be too much of guilt. To overcome the guilt, what she will do? She will vomit. How does she vomit, sir? She'll put the fingers into the throat, and because of that, what happens? There'll be a self-induced vomiting. Because of that, only the teeth will cause injuries over the knuckles, which is called as, do you remember the sign? Russell sign. Now, along with the vomiting, what happens? Acid is coming out. So what happens? H plus Cl is lost. So what happens? They are result in hypokalemia, and metabolic alkalosis. That's what was the question. I was very happy to see this. Answer was metabolic alkalosis. Yes. Most repeated question. Okay, eating disorders, anorexia and bulimia is most repeatedly asked, and it is often asked in exams. Okay, next question was substance use disorders. This is what I've told you. Even in my class, I used to say it's very important. You cannot afford to miss this question. Okay, now what happens is that a 45 years old man presents to the hospital with complaints of seeing snakes crawling. Is seeing snakes, that is crawling. Okay, inability to recognize his own family members. So basically what happens? There is disorientation to place and person, visual hallucinations. His last alcohol intake was 48 hours ago. What is the most likely diagnosis? And I would suggest the answer is most repeated delirium tremens. Do you remember this paper, this page where I would have told you? See, we should be having it very clear. When a person takes alcohol for years together, what happens? Suddenly, if he is going to stop alcohol, what happens? Most common withdrawal symptom that we have is tremors. Within 6 to 8 hours, you will have tremors. Within 12 to 24 hours, you will have REM fits or GTCS. Within 72 hours, what you will have is DT. What is DT? Delirium tremens. Now, this characteristic feature of delirium tremens is very often asked in exams. I always tell students, please have this very clear. Because, see, asking a one-liner for an examiner is very easy. Asking a clinical related question is a bit difficult. Because he has to frame all these words into the question paper. The person will have altered sensorium, clouding of consciousness. His consciousness will be clouded. There will be disorientation to time, place and person. There is a problem with attention and concentration. There is visual hallucinations, Lilliputian hallucinations, and there will be sundowning phenomenon. What is this Lilliputian hallucinations? There will be first case of delirium tremens that I saw in my clinical experience was a person who claims that, sir, 2 centimeter people, sir, they are coming and throwing stones at me, sir. Small elephant, sir, is climbing and standing on my shoulder and it is making noise, sir. So I'm able to see small elephants. So it will be visual hallucinations, but it will come in small form, miniature form. That's why it is called Lilliputian hallucinations. Why it is called sundowning phenomenon? When the sun goes down in the late evenings, there will be worsening of symptoms. I've told you already, delirium tremens is nothing but, in your question, it will be altered sensorium. Here the person says that is disorientation, time, place and person after around 48 to 70 hours of last drink, and the answer is delirium tremens. Yes. It's a most repeated question. I will be telling this to all the students. Either it is a NEET or INICT or FMGE, I'll be telling this. This is the most very repeated question. Okay. And I was very happy when I saw this question. Yes. Next, there was a psychopharmacology question. Usually pharmacology is volatile. People will be like, oh my God, it will be very difficult and all that. But this time I think it was very easy. Okay. Why? They have asked that a 22-year-old woman diagnosed with schizophrenia, she's having some psychosis, has been compliant with the prescribed olanzapine. Okay, she's taking a medicine called olanzapine. However, she discontinued treatment. Okay, which of the following is the most likely reason for discontinuation? Okay, the answer is weight gain. Answer is weight gain. Okay, do you remember me teaching in your class? Okay, I've told you when it comes to weight gain, okay, when you come to antipsychotics, there are two culprit drugs. There are two culprit drugs, which is olanzapine and clozapine. It literally causes ballooning effect. It literally causes ballooning effect. People will come with 25 kg. Okay, within 3 months of starting the medication, they'll be like 50 kg. Okay, ballooning effect you can see. It's because of olanzapine and clozapine. Whereas two drugs which will have least weight gain is A to Z, aripiprazole and ziprasidone. And again I am telling you students, please give importance to PYQ. Why we always say give importance to FMGE PYQ, INICT PYQ and NEET PYQ, even though it's an FMGE exam? Because see, one of the question I told you, label and difference was directly copy pasted from your previous INICT exam. Now this FMGE question was a question which was asked, like a modified form was asked. A person was already obese. A person is already obese. You want to choose an antipsychotic. Which antipsychotic you will choose? That was the question it was asked. And I've told students, always remember it as A to Z. Always remember it as A to Z. What is that? A to Z. Aripiprazole and ziprasidone are the drugs which has least weight gain propensity. So you choose this drug. Will you choose olanzapine, clozapine? No. Why? Because it causes increased weight gain. So it was what they have asked in the exam. It was what asked in the exam. Okay. So it was also an expected question which was discussed in the exam. Usually there will be usually a question on forensic psychiatry, because last time there was a mentally ill person who will give consent for the procedure. A legal guardian question was asked for FMGE, but this time there was no forensic or community psychiatry, but there was a question on phenomenology. Okay, mental state examination. A doctor asks a patient about the age. What is your age? What will he say? Sir, 24 years, sir, 35 years, sir, 45 years. The patient responds, you know, doctor, I am from a village. We were married at a very young age, at 12, with my husband, who is just 5 years older than me. Then I had 2 kids when I was around 18 or something. Now I look like their older sister. I am just 32, doctor. So basically what should have been our answer? I am 32. So this was a question. This is the answer. But is she reaching the answer straightly? No. She keeps on talking unwanted things. That is called as beating around the bush or circumstantiality. Circumstantiality, which is the answer A. Again, I've told you, in the stream disorders, there is something called as circumstantiality. For example, I ask you, how will you travel from one place to other place? Okay. For example, from Chennai to Delhi, how do you do? How do you go? Or from Pondicherry to Chennai, how do you go? Sir, morning 6 o'clock, I woke up, sir, I brushed my teeth, sir, I took bath, sir, I went to the bedroom, sir, I packed all my bags, sir, I went to the bus stop and there were no buses, sir, I went to the hotel, I ordered some food, then the order came, I ate, then I came, the bus came, the bus, I landed in the bus was a very long journey, the driver was very going slowly. I think the driver was previously driving a bullock cart, he's driving very slowly, he says driving as if he is driving a old goose train. Now there is a old man who's sitting near me, is continuously coughing. I'm getting a headache because of the old person. He's keep on talking nonsense. Slowly the bus reached Chennai. So basically what happens, you can just say it is a long journey, but you keep on talking unwanted things, which is called as circumstantiality. Circumstantiality means beating around the bush, which is in an organic brain syndrome. Again, it was discussed in our exam question. So I was very happy when they got this question also. So actually, to be frank, when I used to say, we have a group where we discuss questions, and when the other faculty, other psychiatry faculties from different platforms, they were telling that there were questions asked, and we were seeing the questions, we were very happy. Why? Because we had 100% target rate. Like we got all the questions that was discussed, and nearly 3 questions which I told that this is expected, this is expected, this is expected, came in the exam. So I was very happy. I hope that you would have also had a wonderful experience, and similarly you would have had other subjects also. So it was nice having a discussion. I thought that we should have a discussion right now, so that you'll be able to see and try to revise certain things, and also tell your juniors also. Yes friends. Thank you friends. Have a good day. Take care. Bye.